Okay, great. So now I have the pleasure of introducing you all to Dr. Marline Squance, who has had a long career in health management and research. Marline was the CEO of a non-for-profit charity, the Autoimmune Resource and Research Centre, ARRC, for 18 years, and oversaw its arms of operations and also its diversification and merging with Arthritis New South Wales in 2021. Marline has degrees in biomedical science, diagnostic cytology, and environmental science, environmental health. She's qualified and certified lifestyle medicine professional and has a PhD in immunology and microbiology. Marline's main area of research interest has been in systemic autoimmunity and the effects of the environment and lifestyle on people living with these illnesses. Her work focuses on improving health education and providing guidance for people living with autoimmune illnesses to improve management of illness symptoms and improving quality of life. Marline has worked both internationally and nationally in the health sector, beginning her career as a cytotechnologist and a medical researcher at the Royal Newcastle Hospital, and continued to work in this field at a senior level in Austria, Canada, and Switzerland. Her career pathway is yet again taking various new directions, with Marline developing a startup business, My Autoimmune, to continue her work with autoimmune patients in health education, therapeutic product support, and due to requests, a personalised lifestyle management program arm and a consultation service called My A Wellness. Marline's also a keen gardener, animal lover, and a very amateur artist, always looking to try new things to broaden her mind, body, and personal wellness goals. So it gives me great pleasure to welcome you this morning, Marline.
Thank you. I saw that your slide there had the Autoimmune Resource and Research Centre, and many of you may be familiar with me from that area. But also, I was speaking with Louise, and I used to be the Vice President of Scleroderma Australia as well, many years ago with Robbie Sims, and that. But now moved on, and as ARRC has now merged with Arthritis New South Wales, and I took the therapeutic arm of what we were selling, the products and things like that, and set that up as an online business with, just to continue the supply of useful products and that. So today I'm going to be talking about Raynaud's phenomenon, and I guess I'll start first of all in saying thank you very much for this invitation, and that. But I always find it's useful to try to sort of, find out where the actual names may have come from, So Raynaud's is quite an unusual name, but it actually has come from the person that first wrote his doctorate on a condition. And his name was Maurice Raynaud in 1860, a Frenchman. And basically it all came from an instance where he was sitting at a bus stop beside a lady in the middle of winter, and he was watching that her hands were turning from red to blue to white, and that he thought this was fascinating. So he decided that he would study it, and he ended up publishing his PhD, his doctorate, and he called the conditions Raynaud's phenomena. So he named it after himself. So there you go. So we've had a little bit of technical issue today. So Louise is going to share my slides. So if we could move to the next slide. Okay, I thought today what we talk about is the facts. Diagnosis, the difference between primary and secondary Raynaud's, some of the treatments that are available, and also, very importantly, your personal line of defense. So self-care management, prevention, monitoring, supports, and lifestyle management. The next slide. So the key points. Raynaud's is a condition of vessels, and it's a condition of vessel spasm triggered by cold and stress and emotional responses. I actually have seen people that are in fits of laughter also have a response in that particular case. So it's not always emotional distress. It can be any other emotional changes in that as well. It's a common finding in healthy people, so it's not a rare condition at all. It's probably between 5 And in some cases, I've seen reports of 10%, but generally it's around about 5% of the general population. And it does have a particular heightened prevalence in women, which is quite common for autoimmune illnesses anyway. It can exist as a primary illness where it really is not in conjunction with any other illness. And then also, which is many of you with scleroderma would understand that it can be a sign of autoimmunity and an autoimmune condition. In fact, with scleroderma, the R in CREST for limited scleroderma, that the term that used to be used, stands for Raynaud's. There are some useful tools that have come forward in the last probably decades, and one of the things is now fold capillaroscopy. And this can help to define whether somebody may have primary illness or whether they have secondary illness, but also about what sort of active phase they might be in if they do have an autoimmune condition such as scleroderma. And a lot of this has been run out of UK and the Italian groups run by Catola and Sulu. And it's something I will show you some slides about now, fold capillaroscopy. Not all rheumatologists and immunologists and people that are treating it do have access to these types of machine, but they may be able to look at your nail fold anyway. Raynaud's is a common condition, common symptom of scleroderma, and it's often the first symptom that people will present with. So they'll go to the doctor and say, oh, my fingers keep on going blue, white, and everything else. What is this? And it can be an indicator that something else could be going on, and it's really should be an indicator for medical practitioners to look further. Not always that way, because I'm sure many of you will recount a case of being dismissed and says, just live with it, just get on with it. It happens commonly, but I think that if you do have Raynaud's, then I think I would press further to say, let's look into it further. Self-care and lifestyle management is vital, and I won't underestimate that, because it's the first line of treatment, and it's the thing that you can do for yourself and to prevent yourself from needing to go on to other sort of, I guess, more invasive types treatments and medications and pharmacology. So we go to the next slide, please. I'm going to have to get used to doing this next slide. Yeah. So I'm a bit of a control freak. I like to control my own slides. Yeah. So this is a nice little indication of what happens in your vessels. So basically, vasospasm stands for vessel, and spasm being shrinking or constriction of the vessels. So what happens, Raynaud's is classically a tricolor type condition, but can also be involved with bicolor and even just a single color change associated with pain and other types of symptoms. So the color changes you'll all be very familiar with from white, blue, and red. So generally, the white is when we have no blood flow, and it can be quite clearly demarcated on the fingers and the toes. The blue is when there may be still a little bit of blood going through, but the oxygen within the blood vessels has been exhausted. So the deoxygenated vessels, the deoxygenated blood gives that blue color. And the red is due to reperfusion of the blood and the blood supply, the oxygen flow. So they're the three colors that you would classically see. So it often, it's usually in the small vessels and can occur in any area that really you have that small vessel collection. Most commonly, people will see it in their fingers and the toes. I have Raynaud's in my feet, but not in my hands. But generally, people would see it first in their hands because, you know, we often wear shoes and socks and things. But you can find it in other areas such as the nipples, the tops of the ears, the tip of the nose. Some people have reported it on top of their head. And so there's other places in that as well. But it affects the whole body. It's the whole blood system that's involved. But it's the extremities where you get to see the signs. As I said, it's brought on by cold temperatures often, but also emotional responses, including stress and joy. It can be a painful condition and is often a painful condition and can lead to complications. So it is an important condition. So it should be looked after and it should not be dismissed. And I can't emphasize that enough. Next slide. So as I said, the changes are often seen in the fingers, toes, the ears, nose, and nipples, and it's usually repeated episodes of bi or triphasic colours. It normally If it has a uniphase color, it's normally to a white phase and associated with pain or numbness. It can also be associated with pain, heat, tingling, loss of feeling, pins and needles, numbness, and also muscle weakness can occur as well, which is something that people don't often think about. But I've also added the word there, silent, and I always recount a lady when I was giving a presentation in the central part of New South Wales, and I saw this lady as she was in the front row, and I just watched her toes go from white, red, blue, all different colours throughout the day. And I asked her halfway through the day whether she needed any help, and I had some socks there. I said, would you like some socks? And she literally said to me, she said she doesn't feel it. She doesn't feel any change at all. She doesn't feel any response. She doesn't have any numbness or anything like that. But, you know, she did have her thongs on, so she wasn't really protecting her feet. And she said, I never really think about it. And, you know, and the doctor just said to me, you know, just go away and live with it. You'll be fine. And that. So I've added silence there because over time, people will ignore the symptoms and not necessarily pay much attention to it. So silence is there as well. Next slide. Okay, so primary Raynaud's Raynaud's phenomena is not necessarily associated with an underlying cause. It is quite prevalent in the general population, and there's no clear cause as to why it does occur. It does have some, I guess, age basis, and that often Raynaud's will get better in pregnancy and but there are age different groups, and we will talk a little bit more about the differences between the two. Secondary Raynaud's is something you guys would be very familiar with, which is associated with an underlying cause such as a connective tissue disease like systemic sclerosis or Scleroderma, but also lupus, vasculitis. Sometimes malignancy can cause these problems, and peripheral vascular disease. So anything that's involved with the vessels can actually have these responses in that as well. Next slide. So here we are, we've got a slide that shows the differentials between the two. So there is somewhat of a differential in the age onset, with primary Raynaud's being a little bit earlier than secondary Raynaud's. And this can relate also to the prevalence of autoimmune illnesses. Autoimmune illnesses, they talk about a general prevalence across the board being around about 25 to 45. And that where we often see that with lupus, scleroderma, and such as well. So in primary Raynaud's, it's more common in women, and it has a familial component to it. So often you'll find there will be a family member that's also had Raynaud's as well. The symptoms occur generally alone without any other associated symptoms. Otherwise healthy people, so they don't have other conditions. The spasms that occur in the vessels will often result in a symmetrical change. So if you have one hand go, the second hand will go at the same time. So it's not a symmetrical response. If it's not a symmetrical response, if you have just a single finger and that's in one hand, that should be an indicator where you should go and get things investigated, because there may be something else that's going on, whether it's an autoimmune illness or whether it's something else. You could have a little blood clot, a little vascular, an aneurysm or something in the finger, but it certainly needs to be investigated. No tissue adverse responses such as gangrene or injury, no digital pitting occurs within primary Raynaud's phenomena. A negative null fold capillaroscopy, which I said we'll talk about again, negative autoantibodies, the ANA, which many of you would have had a pathology test done for that, and it doesn't come with inflammation and inflammatory response. It can spontaneously go back without any signs, you know, later on in life, so a remission. Less medication, even if any medication is offered at all. And the episodes and the spasms that are generally experienced usually resolve with any sort of like injuries, sort of like ulcerations or anything like that. As a contrast, in secondary Raynaud's, it's a later age onset. It's common in both males and females, but once again, females generally have a higher prevalence. Symptoms is in combination with other symptoms that you would experience with something like scleroderma. So you may have other types of calcinosis, other types of skin problems and things like that. Usually the attacks don't necessarily have to be symmetrical, so they can occur in one area and not another. the spasms and the Raynaud's occurrences can be quite painful, can be quite severe, and can occur with ischemia, ulcerations, and things like that. Injury can frequently result, and part of that is because of some of the other symptoms of scleroderma, but also because of the numbness and that can occur with it. Filaroscopy changes do occur, and we do see them within the nail fold itself, but we'll talk about that again. You do generally will have a positive ANA and also signs of inflammation. So whether that's associated with just the Raynaud's or whether it's to do with scleroderma or lupus or one of the other autoimmune illnesses, we're not quite clear on that. Ischemic signs usually occur in the fingers and proximal to the fingers. So probably sometimes the hands, the arms, the toes, the foot and the limbs. So you may end up with ulcerations on the ankle, not necessarily on the toes itself, but it's a result of the lack of blood flow and a lack of oxygen to those areas. So next slide. So epidemiology is the features of the illness, I guess, and how common it is. So as I said, it's approximately 5% of the population in Australia, more common in women, and prevalence of primary Raynaud's, it varies across countries, across sexes, and also the one thing I haven't mentioned before is it can result from exposure to vibration in the workplace. So a lot of people that work in construction, particularly using things like pneumatic drills or painters that use sanders and things like that, whether it's through trauma, and it probably is through trauma and repeated trauma, they can end up with a primary Raynaud's condition that as well. And obviously across country, we have colder countries, we have warmer countries, we have different geographical lines and things. And I listened to some of the conversations here, the conversations of people that live in Queensland opposed to Melbourne. And we do have the Raynaud's nomads that whether they move permanently to a warmer area or go just in the winter area, it is a very real thing of people that move. And certainly in the US, we always hear about people moving to Florida for the winter. And often it's to do with more comfort and such. So it may not stop all of the Raynaud's attacks, but often it will reduce the frequency and the intensity of those Raynaud's attacks. And that is an important thing, because the more attacks that you have, the more risk there is for more damage and more adverse events. Next slide. So the etiology is what causes the illness, what causes the condition. So we're not entirely clear, but the cause of Raynaud's, primary Raynaud's, is not known at all. It just seems to appear. We often see young children and it carries through their life. And it's a relapsing, remitting type illness. So it comes and goes, as associated with your emotions, but also your cold temperatures and that. As we've said, it's a vasospasm, and vasospasms in your extremities and throughout your body is a normal reaction. But what happens in Raynaud's, it's an exaggerated response. So it's an exaggerated response to changes. So cold, temperature, emotions, those sorts of things. And so it's normally the fact that your body opens and closes its vessels throughout the day, but it's normally in a balanced fashion. So what happens in Raynaud's is that balance goes off kilter. So many factors are upregulated, and so the problem is basically people are thinking that it's to do with the local production of hormones, and the hormones are actually in the vessels itself. And so the hormones are the things that keep the vessels open, and the hormones are the things, a different hormone closes the vessels. So there's a particular hormone which causes an endothelium-dependent relaxation within the vessel. And so what they're thinking is there's an overproduction of one hormone and a depletion of the hormone that actually closes the vessels again or opens the vessels. So what happens in Raynaud's is the lining is not functioning appropriately. And so there's not enough dilating hormones and too much of the constricting hormones that cause those spasms itself. They're not sure why this occurs, and I can't sadly give you an answer to that. It may be as a result of scleroderma, it may be a result of some other process that's going on, biological or biochemical process that's going on in the body. So it's sort of genetics can be associated with it. So as I said, primary Raynaud's often has a family history of somebody with Raynaud's. And secondary Raynaud's often will have a family history of a connective tissue disease or autoimmune illness. And I think that many of you will relate to the fact that you may have somebody that might have another autoimmune illness. It may not be scleroderma, it could be lupus, could be allergy, could be something like that. So often we find that there's a spectrum of autoimmune illness that occurs across families, and that it's not necessarily the same illness. Another important concern is that people that suffer from glaucoma and migraines can often have Raynaud's as well, because the blood vessels supply all of the body. And in cases of glaucoma and migraines, there's an interocular pressure that occurs that raises the pressure and such. And so the vessels to the eyes and to the brain can also be affected in that the vessel changes, the hormone changes there. Some drugs can have an impact on Raynaud's. So as I've said there, beta blockers may worsen Raynaud's, but randomized controlled trials have shown that beta blockers may also reduce the vasospasm. So it depends on the type of medication. And I'll tell you from the start, I'm not a pharmacist, but I've just read some of the research out there that points to beta blockers, and this is where you would be advised by your doctor. So next slide. I thought I'd just present this lady, and I think you'd be very familiar with some of these symptoms and that as well. So this is a case study of a lady that's 50 years old. She's developed puffy hands. She has new symptoms of Raynaud's, as in colour changes, and has discovered that she has difficulties in swallowing over the last year. So basically, there's a few things that would raise the indication that this may be secondary Raynaud's, and it is secondary Raynaud's, and that is, one, the lady is 50 years old, so she's of an older age group, puffy hands, the changes in the colours, but also the swallowing difficulties, because the other thing that we've found is that there is a gastrointestinal link to Raynaud's and that as well, and many of you would be familiar with the fact that you may have esophageal problems, or you may have reflux, and that, so there can be an indication of a link there and that as well. The lady also had some small telangiectasia. Well, you can say whatever you want. I say telangiectasia, which I'm told is wrong, but that's the way I think. The tiny little red dots that you find on your skin, on the hands and the lips and things like that. She had them on her hands and lips, but you often find them on your body, your torso, and certainly on your face and that as well. So these are a vascular malformation. It's a collection of blood cells in a certain area and that as well, which is also another indicator. She was sent off for chest and abdominal examinations, and they were unremarkable, but she was also found to have inflammatory arthritis, which is a part of another autoimmune condition and that as well. Her ANA was positive with this beautiful, wonderful ANA little slide here with the nucleolar pattern. So the tiny, shiny little green dots that you have there, they're the powerhouse of the cell. And so the nucleoles are quite prominent there. There are other ANA patterns that can be related to certain types of scleroderma. There's an ANA pattern called a centromere pattern, which is often associated with CREST or limited scleroderma and that as well. But this is an indicator that something is happening in an autoimmune area, because this is an auto-antibody that is being now causing this reaction. She had nail fold capillaroscopy, and these showed dilated capillaries at the nail bed. So when we talk about the nail bed, when you do nail fold capillaroscopy, it's right near where your cuticle is, just behind where your cuticle of your nail is. And they basically just take a little picture that can actually see through your skin and see the vessels and see what the vessels look like and what they're doing. And the other thing is that she currently had a digital ulcer. So this lady had secondary Raynaud's as associated with systemic sclerosis or scleroderma. Next slide, please. So the risk factors, and I have to power through, we're at 11:25 already, my gosh. Risk factors, so strong risk factors are female, family history in particular with primary Raynaud's, connective tissue disease, vibration injury as regards to pneumatic drills and other sort of vibration illnesses, and also a condition called Berger's disease. Berger's disease is something that can occur in smokers, and so one of the things to help with your Raynaud's, if you're a smoker, is to what? Is to stop smoking immediately, because it actually has effect on the circulatory system and the vessels, the Berger So it makes, I guess, in Berger's disease, the vessels become hypersensitive, and that's kind of what's happening in Raynaud's and that as well. You have a hyperreaction to different stimuli, whether it's an environmental or emotional stimuli. But in Berger's disease, it can be easily resolved by giving up smoking and allowing time to actually recover. The weaker factors are prolonged cold exposure and frostbite. We do have many people in the world that live in very snow-ridden countries, and even though Raynaud's does exist, the prevalence rate is not extremely different to what it is in Australia. Colder climates do have an impact with the number of spasms that you have. Smoking is a big one, which is a risk factor. Ischemia, if you have a loss of blood flow, migraine and glaucoma, like I've said before. So next slide. So diagnosis, the risk factors we've just spoken about, but diagnosis, you need to see somebody to report changes if there is a sudden onset of changes, like you start seeing that there's colour changes. Well-defined discoloration, particularly with the pallor, the white colour of the fingers. Changes in feelings like numbness and tingling. Digital changes such as pain and discomfort, abnormal sensations, the colour, the red-blue change. Abnormal nail fold papillary changes, but normally you would not go for fluoroscopy unless there's something they're suspecting in the first place. Next slide, please. Other features. Reflux, difficulty swallowing, dysphagia, puffy hands, tight skin, arthritic type pains, and particularly in your joints, photosensitivity, mouth ulcers, alopecia, butterfly rash. These are probably more related to lupus than scleroderma, but also sclerodactyly, you know, the curvature of the fingers that you will see in some people with, oh, thank you, Liza, showing us a demonstration there of the curvature of the fingers with sclerodactyly. The telangiectasias, here you can see it on the tip of the nose and the lips in this picture that's there. Pleurisy, as in serositis, which is the lining of the hearts and the other parts of the body, you can actually get an inflammation, itis being inflammation, so inflammation of that lining. The digital changes like ulcers, pits, tip gangrene, which is quite rare, but it does occur, chilblains, and also autoamputation, which I'll say is very rare. So we'll quickly change the slide on that. So other presentations, Raynaud's causes pain, discomfort, rarely ulcers on the fingers and the toes, but less commonly on the ears, nose, hand, wrist, and forearm. So more severe cases usually occur with Raynaud's when it's a secondary Raynaud's condition. So it's particularly related to connective tissue disorders like scleroderma, Sjogren's, lupus, rheumatoid arthritis, polymyositis, which is a muscle condition, a muscle autoimmune condition. So often the severe symptoms that you will see can be either related to the condition, the autoimmune illness, but also associated with the Raynaud's. It's associated with vasculitis, particularly severe peripheral vascular disease, and it can be seen in malignancy and when people are going through chemotherapy. And certainly people are saying that some of the researchers out there are looking at chemotherapy changes and how the vessels may change the way that they work and their configuration. And they're not sure whether it's a transient response or whether it's something that is long-term after having large amounts of chemotherapy. And there's a medium vessel vasculitis disorder called polyarteritis nodosa. That's a big word. And occasionally in lupus, this is where you're more likely to see gangrene of the fingertip and the entire finger. So next slide. As we said, it can occur in vibration trauma. And this can occur through any sort of like activity with vibration tools. And it's often as a result of trauma and repeated trauma to the vessels. And if the trauma is there, the vessels are really clever. They can regrow and they can redevelop, but they often will develop in an abnormal pattern, not necessarily in the normal pattern that we will see. And I think we're coming up to the next slide or two with the fluoroscopy. You can see what we're talking about. To rule, yeah, the next slide, you're right. Yeah. So to rule out secondary illness, often the doctors will send you off for a chest X-ray to see if there's any sort of lung involvement. And then you'll certainly get pathology done, like as in bloods, as in ANAs and other autoimmune markers. They will often check your urinary function and your renal function, because there can be a link there when they find casts and cells within the urine, or a protein deficiency, or protein development and deposit in the urine itself. They'll look for rheumatoid factor and also complement, which is a sign of inflammation and activity. Vascular tests, capillaroscopy, which we'll talk about. You've heard me say this word so many times, capillaroscopy, but we will talk about it. And the wonderful picture down the bottom there is thermography, where they can look at how your body reacts to temperature changes. And I always think they're very beautiful photos, and that as well. And then also some other imaging, laser droplet imaging, to see if there's any sort of blood clots or any sort of irregularities on how the blood is flowing throughout the body. So the next slide. This is my favorite. This is the nail fold capillaroscopy. So generally in people that do not have any vascular issues, around the cuticle, around the nail, you will find that your vessels loop around to these tiny little things. We often call them little soldiers, because to me they look like little tin soldiers standing in a row. And so the top picture in A are normal capillaries, and you will see the vessels loop around nicely, which means the blood flow is not altered at all. Now, what happens in Raynaud's, particularly in secondary Raynaud's, you will see that the vessels start to dilate and start to have an altered blood flow. So you can end up with dilated capillaries, you can end up with tiny little micro aneurysms, little micro bleeds, and these can cause the vessels to loop around, to change their shape, but also in active and late phases of illnesses, it can actually cause the vessels to not be visible at all, which is cause an avasculation or a bleaching or a dropping out of the vessel action. You can end up with a changing and these things where they can develop a pattern called arborization, where it looks like trees, where you have the vessels changing their shape and looping around. So rather than being a single loop, it becomes a multiple loop with an altered function. It's a very, very sophisticated test. It's a very non-invasive test. Basically, they're just taking a picture of your nail folds, but it can be a very, very powerful test in that it can help to find whether you have primary Raynaud's or secondary Raynaud's. Somebody that has primary Raynaud's will show a pattern which is like number A, a very normal capillary function with the nice little vessels, so looped fossils. Somebody that has secondary Raynaud's is more likely to be showing B, C, with some sort of dropout, some sort of changes in the vessels. It is now often used in guidelines as being a measure of checking for activity of scleroderma in particular, and it's certainly being led by the Italian group Patolo and Sulu in that realm, and also a group with Ari and Herrick in the UK. So next slide, please. So diagnosis, differential diagnosis, there's a number of different conditions that can mimic Raynaud's, and here's a number of them here. We don't necessarily have to go into all of them, but so if somebody has a normal reaction to cold sensitivity, they'll have a mottled rather than demarcated sort of change of colour. So it won't be the clearly defined whiteness that you see in the pallor of digits and things. Other responses where in other conditions can have the change of the colour, but there's a different sort of physical pattern that occurs with it. So one of the more important ones down there is a thing called lividio, which is showing this leg here, this lacy purple pattern, and it's really associated with slow venous flow, and it's often seen with cardiolipin abnormalities. Often occurs in the legs and can be seen with people that, particularly that have lupus, but also in people that have repeated miscarriages and things like that. So it can be a real condition that needs to be followed up by specialists. Carpal tunnel, and then I'm sure there's a number of people here that suffer from carpal tunnel. Carpal tunnel can develop numbing, tingling, no general pallor or the whitening of the fingers, and it's really. Oh, sorry, I just saw a message come up. That's all. I was diverted by a message on the side. And it's really a pressing of the nerve fibers, and that which is causing a problem there. We can go to the next slide. Next slide. Oh, it is the next slide. Yeah, health effects. Okay, so health effects, increased cold sensitivity, loss of blood flow to the extremities. And this loss of blood flows has a whole sort of other flow-on effects. You get the color alterations, the loss of blood flow also relates in a loss of feeling, muscle weakness, but it also has an increase of injury, but very much an increased risk of infection and healing. Because if you don't have oxygen, you don't have blood flow to the extremities, your healing of any sort of lesion is going to be slower. So that's why you have to be very, very careful about your hands, protective of your hands, and protecting of and making sure that you deal with any sort of ulcerations or any sort of puncture wound or anything that occur on your extremities, and that because you're going to have a slow blood flow and it's going to be a slower healing process and a greater risk of ulceration and also of a condition called cellulitis where you get infection. The discomfort can be from mild to severe, and that can change across the course of the illness and that as well. And these, when the discomfort range changes from mild to severe, that's another trigger for you to go and see somebody, because your Raynaud is actually changing, your Scleroderma may be changing that as well. It has a high impact on quality of life because it does cause emotional distress, and it causes you to sometimes have social isolation, because you'll find that in winter you'll probably have a tendency to hibernate inside a little bit more than going out, and that as well. So some people can find having Raynauds, particularly severe Raynauds, very, very limiting to their life patterns and their life plans. So you need to plan events. You need to plan the actions that you do, even within the home and even with the home environment, but definitely outside. And protect yourself from other environmental issues. It's not just cold weather, it could be cold winds, it could be other sort of drafts and that as well. So you need to think about what's going on. So next slide. You need to be open and honest with your doctor and seek timely help and advice. And don't, I'm a great advocate for patients to say, don't accept no. So, and don't accept somebody that says you just have to live with it. There's things that can be done to help you, you know, and ask your doctor, ask your nurses about what are the things that can help you. It is always going to start with lifestyle and self-care. But there are things that can, particularly when it gets to the moderate and severe stages, things that can be done from a medical and Western medicine type process. See your doctor if your attacks become more frequent, they become more severe, or your response times change. So responses to a spasm can differ from person to person, sometimes from minutes, sometimes to hours. And that if that suddenly changes, where it's taking longer for your fingers, your toes to revert to a normal state, then you should be seeing your doctor because things are changing that as well. If the conditions become the symptoms that you have, as in if you've never had pain before, suddenly you're developing pain, then that is another trigger for you to go to your doctor to get things investigated. If things like pitting and ulcerations, such as in the pictures that are on the slide there, occur, you should be going, first of all, to get those treated and looked at, but also be showing your doctors that, because that can be a sign that your Raynaud's is actually progressing as well. If cuts are not healing, you need to be treating it to prevent yourself from getting infections such as cellulitis, which can lead to other adverse responses. And you need to have regular checkups, but you should be having that with your Scleroderma anyway. So next slide. A great one for talking about well-being and wellness, and these terms are often interchangeable, but I think they're very important for us moving forward with any aspect of our life, whether we have illness or we don't have illness. And so the next few sort of slides are going to be talking about these aspects, well-being and wellness. So next slide. I gave this talk recently at Scleroderma New South Wales at their seminar, and it was really talking about the pillars of wellness and learning to accommodate illness and wellness, living with Scleroderma. And there's a number of different aspects of the pillars of wellness, but basically the things you're doing today, like what you did before with Louise, learning about your illness, having health literacy, and I heard what Louise was saying, is going to reputable sites, learning how to critique information that's out there, looking after your mental health, keeping active. So keeping active is great for all sorts of wellness aspects of our life. So keeps our weight down, keeps our blood circulating, makes us feel good. You know, it's good for our mental health. So it's a great thing to keep doing. Healthy eating, looking at a healthy diet. So there's no specific diet that is known as an autoimmune only diet, but healthy eating and certainly keeping off the things that we know are not good for us. That includes drinking water and keeping hydrated, often something that people let go. Sleep hygiene, developing up a good sleep pattern, and that can be difficult when you have a chronic illness and you have pain involved, or if you get older, like you know, I'm in my 60s now, so you know, getting up to go to the toilet at night and those sorts of things. But having good sleep hygiene is good. Being very much aware of the risks that are around and risk avoidance, and I've got another slide on risk avoidance and that as well. Good hygiene, it's not just for your hands and your feet, but it's for your whole body. So looking after your teeth, your oral health is really important, and the rational and responsible use of self-care products. And there's a wide number of products that are available to you to use, and some of them are good, some of them are bad, but it's about finding which is the right ones for you. So the next slide. The treatment goals for Raynaud's is to reduce the number and the severity of the spasms. It's about preventing adverse events such as injury and ischemic events, as in ulcerations and that. Treatment goals are always aimed at improving quality of life and the way that you live your life. Focus on education, learning how you can protect to prevent events, and lifestyle changes are very, very important. Self-care, as I said, added with medications if it's needed, and other therapies if it's needed. Things like massage and that can be very helpful. So the treatment, lifestyle changes, and you'll be all very aware of this, and I'm probably going to repeat them over and over again in the next few slides, but gently warm your hands and feet. You know, often suddenly shocking your hands and your feet from being in a response, a spasm, and thrusting them under hot water, and that can actually cause sometimes another adverse event, as in shocking the trauma of the vessels. So gently warm your hands and feet. So you've got, your body is designed to actually give you some very free spots where you can use. You can use under your armpits, you know, as being a nice little spot. Between your legs is another spot to warm your hands. You know, sitting on, you know, using your bottom and sitting on your hands, and that way can gently warm and bring things up to a normal state. Wear gloves, socks, scarves and hats, everything that you possibly can to keep yourself warm. And there's lots of different variations, and we will talk about the types of gloves and socks that you should be thinking about, ones that you should be dispensing with and getting rid of if you possibly can. Warm water, not hot water. But one of the things that people don't realize is, even though your hands, your fingers and your toes are the things that seem to show the physical changes, all of this is coming from the fact that your core body is not warm. Your body is designed so that if your core body is not warm, it's going to rob from the other areas to try to keep it warm. It's all a natural response, but yours is an exaggerated response. So if you need to keep your core body warm, so you need to be wearing things like singlets or camisoles, you know, and certainly not exposing midriffs and things. So next slide. So you need to think about your own life. So everybody's going to be very different. And as Louise has probably touched on in other educations, that autoimmune illness and scleroderma can be a very individual illness, and you may have different symptom spectrum compared to somebody else. So think about your own life, think about your own health, your illness symptoms, and think about what you do. So if somebody that goes golfing and has a wonderful activity of golf, going out and golfing once a week, they're going to think about how they can continue to do that golfing and looking after their Raynaud's. I do have a gentleman that buys gloves from me, and he says that he uses the fingerless gloves because it allows him to still warm his palm of his hand, but still allow him to play the golf. And for him, it's important for him to continue to play golf. But within the home itself, think about, and I heard some people talk about they have wonderful husbands that hang out their washing and bring the washing in. And it's those everyday things that can cause problems for you that you don't necessarily think they're going to problem. You don't often think about it. So hanging the washing out, often the washing is cold and the outside is cold in that as well. So thinking about what you do, how you do it, and how you can do it differently. You know, and I had a gentleman a number of years ago that had gloves for every reason. So he had gloves that were water-lined, that were water repellent. He had gloves that he wore for when he got things out of the refrigerator. He had his whole house changed so that he had like soft knobs on the drawers so that he could open the drawers without injuring his fingers. He had very severe Raynaud's. He would never be, he still gardened. He gardened his gloves, but he often wore 2 pairs of gloves. He had like the warming gloves, and then he had his gardening gloves over the top of them. So he still managed his life and the lifestyle he wanted to have, but he just had to think about the way he did things. And it's a personal choice. Lifestyle management is a personal choice. So next slide. So lifestyle and health management, we've talked about maintaining whole body warmth. It's not just your fingers and your toes, it's not socks and gloves, but also looking at the fact of where you might have heat escape. And one of the first things, I remember when I used to scuba dive, but one of the things that I was told about is that you often lose a lot of heat from your head. So sometimes wearing a hat, and I always remember my mum used to wear a hat, a beanie to bed, and we used to laugh about it, but actually it's very sensible. You know, you lose a lot of heat from the top of your head. So often wearing a simple hat can be helpful. It's very stylish. I always talk to people about maybe start dressing like a European, like we see in Europe with all these beautiful scarves and hats and things like that. Make it a fashion statement. So you need to protect your hands, feet, fingers and toes. So think about the way you do things. Wear proper shoes rather than thongs like Our Lady in Narrabri. You know, wearing different types of gloves that you have. So reduce your stress levels. So there's a number of things that we know can bring on Raynaud's, spasms and emotional distress. Anxiety can actually have a big impact. So learning relaxation techniques, and we'll talk a little bit about that. We're running out of time, but we will. And certainly reduce items that can affect the vascular health. So smoking is a big one, but caffeine. Caffeine is something that we know constricts the blood vessels. So I'm not saying give up coffee, I said, but maybe think about reducing, you know, or maybe going caffeine free, although heaven forgive me, say go caffeine free because I couldn't go caffeine free, but maybe limit yourself to 1, you know, or 2. Maintain a healthy weight and aim for good blood pressure. And I guess that's something that you're guided from your doctors with, of where your blood pressure sits and how you can manage that. Eat well, exercise safely, and when you have Raynaud's, that includes protection, gloves, socks, proper shoes, but also exercise safely by doing it with somebody, walking with somebody, so in case you get into a bit of a problem, you've got somebody that can go for help. And certainly exercise safely. If you've had an adverse event, you've been in hospital or you've had a change, you've had an illness, you may have to start back and build back up again to the levels that you had prior to that. Hydrate. Think about hydration and think about drinking water and fluids, you know, throughout the day. Next slide, please. So we talked a bit about, I said about rational and responsible use of self-care products, but it also can be everyday living aids. So I've got there a pair of tongs, kitchen tongs. Sometimes it's easier to use tongs to pick up things rather than using your fingertips, particularly if you have numbness as associated with your Raynaud's. You can often find that you have difficulty in holding things. And one of the other things I have is I don't know if you could see, but drinking water, I always seem to use one of these insulating little, you know, caps around it, because that can help, you know, to actually, one, keep your drink warm or cool if that's what you want, but also protect your fingers, particularly if you have Raynaud's. There's lots of products that are on the market, and you can certainly find them at different spots. And Louise was telling me last night about she went to Costco, not that we're advocating for Costco, and these little hand warmers, personal hand warmers. This is not a Costco one. You can buy at Costco at the moment. Was it 2 for $99, Louise, that you can get, which they can be helpful. They're USB charged. And I actually find they're better than some of the heaters that use the little metal disc that you have to re-warming all the time. This is a show and tell type thing now. Your hot hands, you'll see them everywhere at the moment. But I think hot hands are great. And one of the beauties of this is that they're actually activated charcoal and iron filings. So if you're worried about having to throw them away all the time after they've been dispensed, they're for single use, but they last for 8 to 10 hours, sorry, not days, hours, sort of thing. So they're great for a day event. So if you're going to the football, you're going, you know, for a picnic or something like that, you can use them for the day and keep your hands, put them in your pockets. And then you can take them home and throw them in the garden. You know, you don't have to put them in the bin, throw them in the garden, they'll enrich your garden. I'm a big permaculture gardener, so I mean, if somebody dug up my garden, they'll be seeing all sorts of things in there. You know, they're great. Then when you're thinking about your gloves and your socks, there's some important things. I mean, I sell the silver thread socks and gloves and hats and things like that. And we've sold them for 18 years with the centre. They've come from the UK, and they were introduced to us by a Scleroderma patient that had severe Raynaud, and she was buying them from the UK. So I now bring them in from Germany now, actually. So they're really good products that can help. The other benefit of this, they're quite thin that you can layer over the top of them. But some of the features that they have, which are very useful, and also things that you need to think about the gloves and the socks that you wear, is that you should have a glove or a sock that is made from natural fibres, as much natural fibres as you possibly can. Because if it's a polyester fibre, what will happen is that polyester will actually promote sweating. And sweating, the benefit of sweating is that it actually cools you. And so if you've got moisture that's there and cooling, it can actually bring on a spasm with using polyester. The other thing that so look for something that's cotton, that's viscose, that's wool, possum fur. I know that people, particularly in New Zealand, possum fur is very, very important. I know we have some people from New Zealand there. They can be really great gloves. But the other things that you should think about is that your gloves should be a single weave. So a single weave going all the way around, so that there's no seams, because the thing that happens with seams is that it can actually cause an irritation, particularly if you've got any sort of ulcerations. Those seams can cause those ulcerations to slowly not heal at all, but also irritate the skin, and that as well. They can actually sometimes seams can actually cause blemishes that weren't there previously. If you do have your favorite pair of gloves that you love to wear and you think it's great and I'm not throwing them away, that's fine. Turn them inside out. Simple solution. That way you don't have the seam sitting directly onto your fingers or your toes. Think about your toes as far as there's often a seam at the end of a sock. So once again, you can turn them inside out, wear them inside out, start a fashion statement. So they're the things that you need to be thinking about when you're buying these products. Think about natural fibres as much as you can, no seams, a single weave if you possibly can. Find something that's comfortable for you to wear, but also think in the case of Raynaud's, and also carpal tunnel is another thing, avoid compression. You need things that are firm enough for you to wear for comfort and for usability, but you don't want something that's going to be so tight that it's going to cause compression of your vessels, because you're already going to have problems with constriction of your vessels. So a lot of these arthritis gloves that you see in the pharmacy and that, they have a purpose. They're very useful for people that have joint inflammation associated with arthritis, but don't have Raynaud's or don't have carpal tunnel. So they do have a purpose as far as that goes, but they can actually cause problems for people with Raynaud's if they're too tight and they cause too much of a compression. So you've got to be looking at the actual fit of the gloves and the socks. I guess living aids are there. They're things that can help you pick up things that you drop, but also thinking about how you do things with refrigerator, getting things out of the refrigerator and freezer. And I talked about my gentleman Gordon that had gloves for everything, and maybe you need to be thinking of that, or relying on other people, learning how to delegate. Thinking about how you're going to open supermarkets where they have open areas where you have freezer sections. And I heard Louise talk about air conditioning. Sometimes you need to protect yourself from that. And so if you're warming a room, sometimes those oil heaters, the column heaters, which is a sealed unit, will take the chill out of the room. They're very economical, but they're not. They actually have a balance of the temperature within your room, and that as well. You don't find that there's a hot spot, cold spot, and things like that within your home. I think that's all I can say there. And then, there's things that plug into USBs to charge. There's also some warmers that do take fluids, but I'm not a great advocate for those because they can have, problems with leakage and problems with sparking and things like that. If I was going to go for a hand warmer such as this, I would go for something that is USB charged, and they can be very, very helpful. Or just simply wear your socks, gloves, and put your hands in your pockets and things that can help. And I'm sure you have lots of tricks. These are also experienced with Raynaud's. I'm sure you have lots of things that you've learned over the years to the way you can cope. So next slide. This is just really giving an indication of some of the things you can wear, but don't forget the man at the front that's looking very stern. He's wearing his singlet, and that's really just to keep your core body warm. So next slide. Risk avoidance, we've already touched on this. This is just a general slide. So smoking, tobacco, e-cigarettes, passive smoking, all of those things can have an impact. Drinking, alcohol shouldn't be, this is a slide I've borrowed from another talk. Alcohol is actually a vasodilator. I'm not suggesting you drink lots of alcohol, but it can be nice sometimes as a calming thing, but it shouldn't be there in relation to Raynaud's. Caffeine, energy drinks, and dehydrations can certainly impact on Raynaud's. And emotional distress, mindfulness, calming techniques is something that is very useful to learn. Fatigue, if you become fatigued, then that can actually have an adverse response on your emotional balance and your emotional ability to cope with any emotional distress. So adopting a thing of activity and rest balance, getting adequate sleep can be very, very helpful. And then general things like keeping your immunizations up to date, taking medications as advised. The next slide. Ideas to keep you thinking, reduce stress and keep warm. That's the balance of everything that we're talking about today. Care for your hands and feet, treat cuts quickly, seek help from your doctors early rather than later, protect yourself from cold but also windy environments, air conditioning in different rooms, cars, studying temperature changes such as shopping, washing. We've already talked about hanging the washing out, refrigerator, freezer, drinking cold running water, those sorts of things. So try to limit those sudden temperature changes. Vibrating tools, I don't want you all picking up pneumatic drills when you have, you know, Raynaud's, because it's not going to be good for you. So don't smoke and drink too much caffeine drinks. Relax and stay as calm as you possibly can. The next slide. Keep active. It's good for us for general health to keep active. So it's important to keep moving every day. Do something each day. Do something that you enjoy. Undertake activity with safety in mind. And some of the things that I've got there, I've got those resistance bands. That can be really fabulous exercise. Link in with a physio or an exercise physiologist to get a program that suits you. Something you could be doing at home, particularly in winter, that you don't have to go out. Next slide. So medications, and we're going to talk a little bit, but as I said, I'm not a pharmacist. So I'm not going to talk too much about this, and we're getting close to the end of time. Louise, have we got extra time that we can go over or not?
Oh, I think we can give you a little bit of leeway, Marlene. But
okay, good. Yeah. Okay, so the thing I've got there is drugs only work if you take them. And I know that sounds a bit funny to say, but there's been research done where that says that up to 50% of scripts that are written by doctors are never filled. And that could be because of financial constraints. It could be because people just decide that they're not going to take it. And that's fine. But you've got to be honest with your doctors, because if the doctor thinks they've given you a script and you're taking it as instructed, and that if you go back to them and you say to them, oh, this is not working, my Raynaud's is still really bad, what they'll do is they'll go to the next level of medications and they'll give you something else, which could be a little bit stronger, could be have a little bit more impact. So just be honest with your doctors. If you're not going to take the medications, talk to them. If you have financial problems, talk to them, because there sometimes can be a generic that can be used, that as well. But also talk to them about any complementary medicines that you might be taking, because there are side effects and cross reactions with complementary therapies. I'm not a person that says don't take them, because I take them myself, and I even make up my own remedies and such like that. But you've got to be honest with the people that are looking after you, because they can probably figure out if there's going to be a cross reaction to the drugs that they're giving, that maybe giving you benefit in some other treatment, such as blood pressure or even for your scleroderma. Take them as prescribed, and that includes taking them at the time of the day. There's some drugs like that are better to be taken in the morning as opposed to the night, because they can have an impact on your sleep patterns. So ask the pharmacist, ask your doctor, and when you should be taking them. Also, drugs sometimes need to be taken with food as opposed to not without food. I'm finding I'm going into a big, health presentation here rather than concentrating on Raynaud's and that. So we'll go to the next slide. So many people with Raynaud's will not require any pharmacological treatment, and it really is concentrating on lifestyle and self-care. And the treatments, the pharmacological treatments, are really only introduced when somebody has moderate to severe scleroderma, or they have a risk of a digit loss, or they have a risk of an ulceration or a infection as a result of that. So lifestyle self-management strategies are the first line of treatment. And that's what the doctors will always tell you, but it's also the thing to do on a day-to-day basis to help prevent you having a spasm, but also reducing the intensity of that spasm. So we've talked about this quite a number of times already, but protective measures make it a daily ritual, regardless of whether it's summer or winter. You may need to increase it in winter, but have a daily ritual, that things that you do. I have gloves beside my computer all the time. I always wear socks because I have Raynaud's in my feet and my toes. Avoid having dry skin, because dry skin can crack, and that could be an entry point for any sort of microbe or any sort of infection and that. So moisturizing your skin is good for scleroderma anyway, as an overall pattern, a general measure, but moisturizing your skin. Wearing gloves, using tongs and other living aids, and see your doctor if the symptoms worsen. So avoiding drugs that may exacerbate Raynaud's. And I've got cocaine there, and hopefully nobody's on cocaine, but it certainly is one of the ones that can do, but also things like some cold medications have been shown to impact on Raynaud's. So anything that's got pseudoephedrine in it should be probably avoided. There's some mixed results as far as that goes, but my way of thinking is if there's any level of doubt, avoid it if you possibly can. So a lot of cold remedies that are out there should be avoided. In primary Raynaud's, it is virtually never associated with irreversible tissue damage, so that's something to remember. So next slide. So the goals are to decrease frequency, severity, and duration of attacks and ulcerations. Calcium channel blockers used like Adalat and things like that have been shown to be very helpful. They do not work in everyone, and every drug has side effects. So it can cause lightheadedness, flushing, ankle puffiness, a few other things that can occur there. It can cause your blood pressure to drop, and which is what causes the hypertension there. The sort of like fainting and lightheadedness and things, particularly when you go from a seated position to a standing position quickly. So some other channel blockers can be used to help with that orthostatic hypertension, you know, the feeling faint. And so there's a few other drugs that can be used that are sort of calcium channel blockers, and these are often the first line pharmacological treatments that they use before they can go on to something that is a little bit more stronger or a little bit more targeted. So the next slide. So when these channel blockers don't work, they can go to a number of different other drugs, and it's your general practitioner and your specialist that will involve you know, deciding on what is best for you based on your health and your other symptoms and other comorbidities that you might have. There are drugs that are used for other conditions like managing blood pressure that are used as antidepressants. Antidepressants have been shown to help with Raynaud's and that as well. And anybody that has a condition called pulmonary arterial hypertension, there's a number of drugs that are used to treat that can actually be very beneficial for Raynaud's and helping to stop the digital ulcerations that can occur. So next slide. So I've just said that. I've just said there's a number of different PAH type drugs and some of the Viagra type drugs, the oral PDE5 inhibitors. They are often used for treatment of PAH, but also used for circulatory issues, and they can be helpful for Raynaud's and particularly any sort of warding off adverse responses. Sometimes the treatments for people that have severe Raynaud's can be intravenous treatments. They can be long-term, but they can also be like a seasonal thing where people, when they're coming into a winter period with severe illness, can often, their doctors may advise them going in for a short stint with some intravenous treatments. There are surgical treatments such as debridement of wounds, which is also cleaning up the wounds. Antibiotics have been shown to have benefit in some settings, particularly when infection is a risk there. So next slide. There used to be a treatment that was rarely used, and it still is rarely used, called surgical sympathectomy. So it's not often done, and it's where they burn and to destroy the sympathetic nerve, and this is a sympathetic nerve response that's going on. So it's done in severe cases, but the thing I'll say is it can be chemically done these days, but it's usually only offers temporary relief of a couple of months or a couple of years, and it needs to be redone, and the symptoms will usually return. Complementary and alternative therapies that have been shown to work is evening primrose oil, omega-3 fatty acids. The fish oils have a vasodilating effect, so they help to open up the vessels to allow the blood flow to come through. Ginkgo biloba has also been shown to have that sort of impact. But fish oils, flaxseed oil, omega-3 fatty acids in that area can be beneficial, and they also can be good for inflammation and treating inflammation as well. Acupuncture has been reported to be beneficial for some people, and when I say here, I say it's for some people. It is an individual illness and it's an individual response that you have. And the silver thread and ceramic impregnated gloves and socks have certainly been shown to be helpful. Oh, my pictures have gone over the wording there. But people that are vitamin D deficient, and often a lot of autoimmune patients are vitamin D deficient, and they can often benefit from D3 supplementation. And they can find some of their symptoms for scleroderma and other autoimmune illnesses, as well as Raynaud's, can improve with D3 supplementation. That's something to talk to your doctor about, whether you're deficient or insufficient, as whether you need that. Pain relief can be important, and there's a number of different treatments that are available. They can be both oral and also a topical localized lotion or something that can be placed on the skin as well. And if the pain is extreme, then certainly there's some other analgesics that can be used. But once again, that's a doctor referral and a doctor response. Next slide. Cognitive techniques. So there's a thing called autogenic relaxation, a progressive relaxation that it takes you through a meditation from the top of your head to the tips of your toes. And it's a slow progressive relaxation, and that's been shown to help with Raynaud's and that as well. And then other cognitive techniques that help to reduce emotional responses are things like meditation or prayer if you're a religious person. Deep breathing exercises can certainly be a calming thing, and it's been shown to be very, very helpful. Visualization techniques, imagine your favorite beach, your sunny environment. You're sitting in the middle of snow. Imagine you're sitting on a beach with the sun and on your face, and that. Visualization techniques have been shown to help. They help reduce stress, anxiety. They improve your sleep. They reduce cognitive clouding, which we all talk about, and that also seems to increase as we get older, the cognitive clouding, the brain fog that we get. But they also have been shown, visualization techniques and cognitive techniques such as mindfulness and meditation have been shown to be very helpful to manage pain. I always suggest to people to create their own quiet sit spot. You don't have to be sitting there obbing, and with your legs crossed, which I can't even do, with your fingers on your knees and that. Just find a sit spot, a nice quiet spot where you can sit and you can just spend some time to do nothing. Learning to do nothing is one of the greatest skills you'll ever learn. So next slide. There's a thing called biofeedback techniques, and this is a technique which I'll say it can be expensive. The clinical trial evidence is not strong. In Australia, it's difficult to find trained practitioners. I found some practitioners in Byron Bay where there's lots of different alternative things up in that area. You need to be personally heavily involved in it because it involves you learning how to control your own body responses. So the premise of this is that you're hooked up with some monitors and you get to see the changes in different monitoring of your responses. Could be your heart rate, your blood pressure, your temperature. You get to see the changes in real time and you get to learn how to control it, like a Zen master learning how to breathe very, very slowly. That's the premise of the process for here. It's about you learning how to control your body responses. To be honest, the responses seem to be better in all the research that's been done on it. It seems to be better with primary Raynaud's as opposed to secondary Raynaud's because there's a lot more things that are happening. It's a simple system, and but if you could find a practitioner, a trained practitioner, you may benefit from it. The long-term follow-up showed that sustained benefit is only 2 to 3 years, but you need to be combining it with something like the autogenic relaxation and definitely lifestyle measures. And when you just use the feedback alone, the research is showing only a 1-year benefit. So next slide. I'm getting very close to the end, as you'd be very thankful for. So these are extreme complications, but it would be remiss of me if I didn't talk about them. So autoamputation is something that can occur, but it's extremely rare, and we are getting better with treatment and people recognizing that Raynaud's is an important illness and it's something that should be taken seriously. Necrosis can occur with gangrene, and that also is quite rare. Things like digital ulcers and digital tuck resorption and ulcers and things like that, the treatments that are available for these digital problems are much more improved. And certainly, as long as you, once again, seek help early, talk to your doctors and your nurses, seek help early, it can actually prevent you from going into the much more extreme adverse responses. Cellulitis is infection that can occur when an ulcer or some sort of opening to the blood system occurs through some sort of injury. So you need to be looking at how any sort of response that you're having, if you have any breakage of the skin, make sure you look after that, you know, with treatment very, very quickly. And certainly calcinosis is something that many scleroderma patients are familiar with, is where you get the little white deposits that break through the skin. If they break through the skin, it's an opening point for infection. But some people feel that calcinosis and the severity of calcinosis, the number of calcinosis that you may have, can be related to inverse or in connection with the amount of spasms that you might have with Raynaud's. So if you look after your Raynaud's, you can actually reduce the amount of calcinosis that occurs in your skin, and that as well. Okay, next slide. Prognosis, it's a relapsing remitting illness, which it comes and goes and may fluctuate in both primary and secondary Raynaud's. Symptoms worsen in usually cold weather, including cold, wet days, even in summer. During seasonal and sudden changes of weather, high wind days, emotional distress, anxiety, not keeping warm, so not being aware of the things that you need to do, and if you have trauma to the affected areas. Attacks can last from several minutes to hours, and that can be an individual response, but you need to see your doctor if that lasting aspect and the normalization of your digits and such, if that changes, you need to be seeing your doctor. In primary Raynaud's, symptoms may become more mild and can even disappear with long-term things, but if it stays and reoccurs, then it may be an indication that you're developing an underlying disorder. And about 15 to 30% of people that have long-term Raynaud's may actually develop an underlying autoimmune disorder. It can take a long time, and I'm sure many of you can account for the fact that you had Raynaud's for many years before you actually were diagnosed with scleroderma. Okay, next slide. You go, yay, summary points. So we're getting to the end. So it's common, it's made clinically, the diagnosis, and it's based on colour changes, but also symptoms. Raynaud's can be standalone condition, but also a secondary illness. Primary Raynaud's often doesn't need any medical treatment, and often secondary Raynaud's does not require any secondary treatment as well. But you may also be getting medical treatment with other symptoms of scleroderma, and it can be benefiting your Raynaud's as well. Complications can occur with Raynaud's, so you need to be vigilant in looking after your health. Seek medical support early to prevent complication. Okay, next slide. Lifestyle self-care strategies are first-line treatments. Maintain whole body warmth, including full body. Protect your hands, feet, fingers and toes. And remember what I said about your design of your gloves. Think about seamless gloves that are natural fibers. Learn relaxation techniques. Reduce things like smoking and caffeine, and general health and well-being. Seek medical advice as soon as concerns are raised, and you may need to use pain relief. That can be important. Minimal evidence for some complementary therapies, but some people may find them very, very happy. Keep yourself hydrated. There's a glass of water there. Hydration is a very important aspect to any well-being, but also with Raynaud's. Next slide, I think is the end. Yes, it's me. That's the end. So that's who I am, and I was the Autoimmune Resource and Research Centre CEO, but I now run my autoimmune. And in the future, probably in the next month or so, we're going to be offering personalised treatments and personalised lifestyle medicine programs for people. But I'm just here to help you, and so I'll leave it up to you for any questions or any comments even.
Thank you, Marlene. That was exceptional. I think I'm way up to date with Raynaud's now. There was a lot of things in there I didn't know, and we do have a little comment in the comment box about you explaining to us about the hot hands and how we can now use those in our gardens, which is awesome. So I'm going to be using them a lot more now. But thank you very much, and thanks everyone for your patience. I know we went a little bit over time, but I think it was worth it to hear it all. So thank you very much. Now, I know I'm very conscious of the time, but has anyone got a really, really burning question that they need to ask before Marlene has to go? Oh, we've got a thank you for the amazing information. Diane and Lynn have both raised their hands. Diane, have you got a question? No, I think it's been up for a while. Might be just Lynn. Lynn, have you got a burning question that we need to get to?
Lynn, you need to take yourself off mute.
The heated jackets or the heated vests, are they worthwhile getting?
They can be often